Good morning to everyone, and thank you very much for coming, and thank you also for the invitation. I am really in a zone at this particular time because I've been working in health and healthcare for a little over 40 years. And it's absolutely amazing to me that we see cyclic responses and issues that we do not seem to be able to intervene successfully in order to reverse the trends that we see occurring. And they have been occurring for a number of years. Even this morning with the introduction, we talked about 25 years out, 50 years out. W.E. Du Bois documented these disparities 100 years ago. They are the same disparities that we have today. What is wrong then in the United States and with us that we cannot intervene with these types of disparities? It is not a hard thing for us to figure out. And indeed, as some have said this morning, we already know the answers. Then what's the problem then? The California Department of Mental Health actually was forward-thinking, and they funded a statewide initiative called California Reducing Disparities Project. How many of you have heard of the California Reducing Disparities Project? Very good. I'm very happy to know that. You can raise your hand because I know you know it also. So in this room, we have 4 individuals who know about the project that has been going on for 2 years. And it is funded by the Mental Health Service Act, which is an act, of course, that was put in place in order to receive money from the wealthy in our state to take care of underserved and unserved and unmet needs in people and populations of need. When the California Department of Health funded this project, they funded 5 ethnic and cultural groups: African Americans, Native Americans, Asian Pacific Islanders, Latinos, and lesbian, gay, bisexual, transgender individuals. The intent was, go out, talk to your people to determine from them what is it that they need in order to have better mental health, so that we could be better, so that we could have better outcomes, so that we could redesign the system in the state of California to be more responsive to the population, its diverse population. That was 2 years ago. All of you are aware, who are from California, that the governor has been in the process of dismantling the State Department of Mental Health, correct? How many in California know that? With that dismantling of that department, that takes away a level of accountability that was an oversight unit to be able to ensure that at the local level that the counties actually provided the types of services that were needed in order for people to have better mental health. That oversight is going to be gone with the Department of Mental Health. But what we have in place is going to be the Oversight and Accountability Commission, which part of their responsibilities, of course, is to make sure that the funds that have been allocated for individuals to have better, underserved individuals, to have better mental health should be in place. As a sequential process is the actual redesign of the department, and so that we will have mental health that is addressed. So what is being worked on now is an integrated approach between public health, mental health, and substance abuse under one particular department. And at this point, it's headed toward the Department of Public Health, so that's where the operations will take place in that area. Now, with our reports and with our project, the deliverable was to produce a population report of your population related to disparity data, related to practices that people felt they needed, and recommendations for the statewide strategic plan. So as a researcher, I used a mixed method approach. We were charged to have a statewide work group. And I had, of course, individuals representing many of the counties in our state. But I conducted a GIS mapping to determine where the black population lives in the state of California. Are you aware that about 73 to 75% of black people live in about 6 counties in the state of California? You didn't know it. I can see the frown on your face. Many of you didn't know that. Where do our black people live? Let's see if we can do the counties. 6 of them. Of course, that's a country by itself. The second one, what's the second highest county with the concentration?
Alameda.
Alameda. Okay, the third? San Bernardino, which I didn't know. And I live in San Bernardino. The fourth?
San Diego.
San Diego or Sacramento. I always get them mixed up. I think it's Sacramento. I think it's Sacramento. Then San Diego, and then Riverside. 73-point-something% of the black population. Well, with our project, we only had $411,000 in 2 years to be able to do this report. Nothing, right? With allocation the first year, about $200,000 for a statewide project. But guess what? Prayed about it, what we need to do, and we're going to use the resources that we have. So we used an eclectic approach, and we went out and we talked to as many people as we possibly could. And we have used different ways of doing that. The focus groups, one-on-one interviews, we looked at some case studies, we reviewed archivable information, tried to get as many reports and data as we possibly could get. And we've had small group meetings where we were invited and we would go and try to talk to people. Guess what? In about 2 months into the project, we were really saturated and we were starting to hear the same thing. So we have the same issues irrespective of where we live here in the state of California. And howbeit, it's probably across the nation the same thing. And you've said it this morning, is that we really truly know what the problems are. The data is out there. But a lot of the data, of course, is incomplete and it isn't accurate and it doesn't properly reflect the extent of the problem. That is the issue critically with the African American population. Because when you look at the disparity data and you first glance, just look at it, and we looked at depression, suicide, all data that we could receive. Basically, the black population was almost on same par with white, Latino, Asian Native Americans and Asians were a little less than those 3 populations. But the largest population that had the greatest disparities were individuals who reported 2 or more ethnicities. And their issue continued to resolve around identity. So you had a lot of depression, a lot of suicide, a lot of types of things in which they were dealing with. So if you step back and just look at the data that's available, the disparity data may not tell us the total story. So then what has happened is that people use one portion of the data that's reported, which is, and you hear it all the time, that blacks are overrepresented in our mental health system.